My name is Brian. I am a senior research fellow at the University of Oxford. For the last 10 years or so, I've been working on the question of a child's right to bodily integrity. Now, in the case of adults, this right is usually understood in terms of consent. Any non-consented interaction with another person's body is considered to violate their right. Basically, their right to set and maintain certain boundaries around how others may interact with their bodily sphere. In the case of children, though, it's a little bit more complicated. First, they're dependent on others who need to care for them and who have to make certain decisions about what should happen to their bodies. And second, in the case of very young children, they're often thought not capable of giving informed, ethically valid consent to a wide range of things that might happen to their body, including some that are clearly permissible, like the case of a life-saving emergency surgery, let's say. So the question is, how do you draw a principled line between the kinds of ways it's okay to interact with a child's body and the ways it's not okay, given that in either case, if they're young enough, they won't be able to consent? Now, this is becoming a central question in public policy debates and even legal questions around a number of different interventions that are relatively more or less controversial. So these would include things like procedures to affirm the gender of a transgender youth, ranging from puberty-blocking drugs to cross-sex hormones later in adolescence, or potentially genital surgeries, although those tend to happen after the age of 18 in the case of this population. There are also surgeries for very young infants who have intersex genitalia, often due to what's called a difference of sex development. In other words, their external genital appearance might not fit the stereotypes for what idealized masculine or feminized bodies should look like. And so it's common for doctors to perform sometimes quite radical and risky surgeries into this healthy tissue to try to normalize their genitalia, and that's controversial. It's also legal to perform penile circumcisions, which involve removing about a third of the penile skin system, typically for cultural or religious reasons, obviously without the consent of the child if they're young enough. And then there are also questions now around female genital cutting rituals on the one hand, and so-called cosmetic surgeries on the other hand. A recent report came out in the United States showing that fully 20% of cosmetic labiaplasties were performed on adolescent girls under the age of 18. Meanwhile, in the United Kingdom, in 2015, there was an important court case concerning what's defined in British law as FGM, or female genital mutilation. And what was at stake there was a kind of ritual in a Muslim community that involves pricking the clitoral hood to release a drop of blood for ceremonial purposes, but without actually modifying the genitals. So, given all these difficulties and inconsistencies, there's clearly a need to try to think systematically about all these different kinds of modifications of a child's body to determine in a principled, fair, just way which are the ones that should be allowed and which are the ones that should be prohibited.